Hi Charlotte, today we're doing an assessment with Mr Lyons. Now you've read his history.
Yeah.
What can you tell me about him?
He's a 79-year-old man. He was admitted to Freemasons Hospital at the start of the month with sort of shortness of breath and chest pain. And then he was sent to Frankston Hospital and he was diagnosed with pneumonia. And he's been here for about 12 days or so.
Here?
At Golf Links, he's been here for about 12 days or so. He lives at home with his wife. He's generally quite independent with most things. She helps out with some things. He's got a history of COPD and some heart problems and hypertension. He's had a hip replacement, but generally he's quite active and quite well.
Is there anything else that you gained from the history?
He's quite independent, so his rehab's been going quite well. His goals are to be independent with all his PADLs, and he's achieved that so far, to increase his strength and his balance, and he's going well with that.
Is there anything else you would need to know to do an assessment with him that you could gain?
I could have a look at his medical charts to see how he is when I go in, to see how his oxygen saturation or his blood pressure, because he's had some problems with his blood pressure before. He's also recently been diagnosed with aortic and mitral valve stenosis, but it seems to be being managed well.
Okay.
So,
do you know anything else more about his sort of pre-morbid mobility?
He used a single point stick, and he was quite active. He drove. Him and his wife, attended to community activities together, and his wife generally took care of the domestic activities, but he was quite capable of doing it himself.
Has he had any history of falls?
Not that I could see, no. So he's quite fit and healthy generally.
And any other sort of admissions recently? Or?
Not recently I could see, but as I said, he's had problems with his heart, but it's generally well maintained, and he's had 2 hip replacements.
Okay. Now, from what you've read in the history, do you have a bit of an idea of what questions you would like to ask him?
I'll initially ask him how he's going today, if he's having a good day, how he's previously been given some breathing exercises, so I'll see how they're going, and maybe have a look at his cough and have a listen, and see how he's going with his activities around his room and around the gym.